today we want to look at menopause. It's a subject that much has not been said on. A whole lot of people concentrate on the other aspect of it. They concentrate so much on menstruation.
Menopause is just the end of a woman's reproductive cycle, which includes the ovulation, the menstruation that women experience from puberty. So it's more like a cessation of all of these things together. And menopause itself has three major different stages. There is the perimenopausal stage, and then there is the main menopausal stage, and then there is the post-menopausal stage. And then for the perimenopausal stage is a stage whereby it comes with lots of symptoms and experiences.
Especially in the Nigerian climate, internal heat, that's how they call it. That thing has suffered in the hands of Nigeria. So because like you pointed it out, when these flashes come, most people are prone to mistake it for internal heat, and you see them running left, right, and center. Sometimes you teach in places or in communities, outreaches, online, and you say there's nothing like internal heat.
Actually, there's nothing like internal heat.
Yeah, but they will kill you.
They don't believe.
If you walk on the streets
of
social media and the physical street, everybody's depressed. I know how many times people mention depression a day. You're calling
even when they're not depressed though.
You're
just broke.
Yeah, broke. Or maybe you're hungry, because I won't lie to you people. Anytime I feel hungry, sometimes it looks as if my mood is low. So
I actually encourage from you yourself. I think there's this actress I like, Educator. Okay, she does exercises. She's very, very agile. I think she's around 40 something or
50.
50. I said she turned 50. Do you get? And she looks so good, and she lifts good weight. I feel like if women could actually embrace exercises more towards that age, it will help. I feel like that's why I feel like men should actually be passing through menstruation, so they can relate to the pain that comes from menstruation. You get? So if
the studio manager wants to.
So if actually men should experience the symptoms of menopause, number one, during sex, the woman's vagina. I didn't even talk about the vagina.
Yeah, no, we'll get there. We'll get there. Yeah.
Okay, before we get, so if they could experience these symptoms, at least a part of it, they'll be able to have more empathy towards these women. So for you as a man, there are other non-sexual things you could do to bond
build
and
intimacy.
build intimacy with this person, like hugs from the back, cuddles, warm baths, and all those things can help too. Both of you will feel good without engaging in sex.
In intercourse.
Intercourse itself, you get. And then for people that really have to engage in intercourse, I'm not saying you should stop intercourse totally. I'm saying
even some women, I've met women who say that no, you cannot say that you are my person and there's no sex. There are women that say they have, because when you speak to people, they talk about high sex drive, high libido, and people talk about sexual compatibility. Sometimes they'll be like, I'm high libido, I need somebody with high libido, and you tend to forget that sometimes this libido will dwindle down. How does menopause affect a woman when it comes to sex?
Okay.
Hello everyone, this is another episode of the Intimate Matters podcast, and as always on this podcast we take you on a deep dive into the world of sexual and reproductive health, and I am the one to anchor the session. I'm your anchor, Akwaowo Akpan, and with me today we have an amazing personality, and we'll just be talking about one issue that is very pertinent when it comes to sexual and reproductive health. Famdi, thank you for joining us today.
Thank you for having me.
Yes, so today we want to look at menopause. It's a subject that much has not been said on. A whole lot of people concentrate on the other aspect of it. They concentrate so much on menstruation, and oftentimes menopause goes under discussed, if I should say that, because most people do not look at it. So Famdi, we want to see what can you say about menopause? Like if you're talking to someone out there, how can you tell the person about menopause?
Okay, I would say in very simple, clear terms, menopause is just the end of a woman's reproductive cycle, which includes the ovulation, the menstruation that women experience from puberty. So it's more like a cessation of all of these things together.
All right. So when we get to a point where a woman does not have to use a pad on a monthly basis to say, or use any sanitary material on a monthly basis, it means that she's come to like the full end of her cycle, and that her fertility period, in quote, is slowly coming to an end. So what are the average age we're looking at, somebody experiencing this?
Okay, although menopause can be also controlled by genetics, but mostly women from 40 years, normally it's supposed to be 45 to 55, but some women from 40 years, so let's just give a range of 40 to 55 years of age, experience menopause.
All right, because I was on a social media platform the other day, and a lady, I think she was 40, she turned 40 this year, was complaining that she's tired. She's tired of buying pad, that menopause should just come, that she's tired. And I know as we progress, we're going to see, and I was just smiling from looking at my phone, I was just smiling. I even had to tell her, like, calm down. You don't even know where you're getting into, right? So what are the things that point? What are like the pointers that, somebody is getting towards menopause or somebody is actually experiencing menopause?
Okay. The first of all, from the age, 45 years of age or older should expect that they will soon get into menopause. And then menopause itself has 3 major different stages. There is the perimenopausal stage, and then there is the main menopausal stage, and then there is the post-menopausal stage. And then for the perimenopausal stage is a stage whereby comes with lots of symptoms and experiences. For someone like women that every month they had ovulation, they had period pains, and then suddenly you're transitioning to a period whereby you're not feeling these things. You're feeling things like hot flashes. This is the most common hormonal fluctuations, because normally the whole reproductive system of the cycle of a woman is being controlled by hormones like estrogen.
Okay.
Particularly estrogen. And then for women that are at the menopausal age, the estrogen level comes down to more than 60%. It's just natural, biological. It comes down, very much down. So because of this, they tend to just throw them into the wind. They're not experiencing that, they never experience like the hot flashes. This one is a very common symptom for most women. They complain of, at a point, maybe like 1 minute to 2 minutes of the day, they feel heat from their chests, from their face, from their arms. Like, you feel the heat. Some of them feel on their abdomen, rarely, but mostly on the upper body. It's like we'll feel these hot flashes. Although there are other illnesses that can be confused with this, but then that test that person can do to confirm that, okay, and then from the age alone, for someone that doesn't have any medical condition most of the time, you should expect that these things will come. You get so symptoms like the hot flashes I mentioned. In some cases, depression. This is very rare, but there are mood disorders. Anxiety is one of them. Depression in very severe cases that come with menopause. And then for some persons, they experience osteoporosis, degradation of bones. At a point, if they don't have arthritis, people that do not have joint pain, bone pain, they start making these complaints every now and then. I can't climb these stairs. I'm tired. Before now, those symptoms were not really there. But because they are close to this age, or at this age, they're supposed to experience menopause. So it's more like something that just happens to them naturally.
All right. Because it's important you say that, especially in the Nigerian climate, internal heat, that's how they call it. That thing has suffered in the hands of Nigeria. So because, like you pointed it out, when these flashes come, most people are prone to mistake it for internal heat, and you see them running left, right, and center. Sometimes you teach in places or in communities, outreaches, online, and you say there's nothing like internal heat. They'll kill you. There's nothing like internal heat. Yeah, but they'll kill you.
They don't believe you.
So that's how it is. So sometimes these women may mistake these flashes, these hot flashes, to be what the Nigerians call internal heat, but it's not supposed to be so. And thank you for pointing out issues with like joint pains and mood swings, because people really know the flushes and maybe the night sweat, which are more or less like
the common
obvious
symptoms.
ones, the common one. Then we have these less common ones like joint pain. So oftentimes it's not, when you see a lady around you, maybe it's your mom, maybe it's your sister, maybe it's a relative, that as she advances in age, she tends not to be physically active as she should be, especially when it comes to mobility. It could be pointing to menopause. It could be perimenopause. And like the family rightly said, when we're talking about perimenopause, because people have these issues, they feel that they'll just wake up one morning and then menstruation stops. So it's like off, and it goes. But it doesn't just cease as it is. It doesn't. Yeah, so it brings, just like it starts, when a young girl starts to menstruate, it's irregular at first, then becomes regular. Over time. Yeah, so as you're about to, finish menstruating, if I should say that, or as you tend to approach menopause, you tend to get irregular menstruation, as the case may be. Now, you mentioned something which I want you to expand more on it, because the issues with mood, because most people are prone to look at it from a physical point of view, but we know that menopause is something that, transcends beyond the physical. It's actually influenced by the physiological, the fact that estrogen level is low. So how will a woman feel when it comes to her mood and her psychology when it comes to experiencing menopause?
Okay. So like I talked about, the fact that the major hormone in the body that helps with this cycle is the estrogen. So in this case, that the estrogen level drops automatically, it will lead to an imbalance in the hormones of the body. So in that case, normally depression can come from other sources. But for a woman that is experiencing other symptoms of menopause, and then for Nigerians, every now and then people complain, "Oh, I'm depressed." You may not even be depressed, but then you will say you're depressed. But then there's also a criteria. There's a criteria you can use to diagnose depression. If you have, I think there's up to an area of 5 to 15 symptoms. And then if you have 5 out of these 15 symptoms, and then you go to the hospital, you can be clinically diagnosed that you have depression. You get. So I won't just say if you feel these mood fluctuations, most of them, they go over time. Like you could feel very down, and then the next minute you're okay. They just fluctuate. But in the case whereby you have these persistent low moods, they come most of the time. For these women that are at this menopausal age, I will actually advise them to go to the hospital and do proper checkups and confirm that, okay, they have depression. And then at that stage, they'll be placed on antidepressants to help correct that.
All right, Coach. Thank you for pointing out the fact that depression can be, clinically diagnosed. Because
definitely,
if you walk on the streets
everybody's depressed.
Of social media and the physical street, everybody's depressed.
Everybody.
I know how many times people mention depression a day. You're calling
even
someone,
when they're not depressed, though.
You're
just broke.
Yeah, broke. Or maybe you're hungry.
Depressed.
Because I won't lie to you, people. Anytime I feel hungry, sometimes it looks as if my mood is low. So it's important that women, with the reduction of the estrogen, your body gets to feel, you tend to have mood swings, and oftentimes it could swing to the high, it could swing to the low, and it could make it that way. And for cultures like the one we have, let's start from menstruation. They don't even talk about it. Now, this is menopause. I think now they're doing so much when it comes to menstruation to a level, May, like the month of May, menstrual hygiene did a whole lot of things. People going to villages.
I actually like the sensation going on these days.
Yeah. But let's look at, why don't we have the sensitization when it comes to menopause? Like, could you think of what could be the problem that we don't hear menopause as much as we hear about menstruation, or maybe other issues that affect women?
Okay, from my own personal point of view, I would say personally that it's more like what society really throws this condition that women feel like, okay, no, for menses now, for menstruation, you're just being introduced to this thing. It's more like puberty. You've been here you'll be like this, you're like your first time. So you're trying to get used to it. And then there are people that have been there before you that are openly campaigning for you, educating you on these things. And then for menopause, you rarely see women, menopausal women, walk into the hospital and say, okay, I want to complain of these symptoms I have. I think most of them don't even know that they're supposed to have these symptoms. The awareness level is very, very low. Using my mom as an example, because I remember when she was complaining of excessive night sweats and then the hot flashes that came. And normally, I think when she went, I think people would tell her, oh, you're having typhoid malaria. Once you're sweating,
always typhoid and malaria.
Typhoid, malaria, you get. So people will tend to misdiagnose these things. But I feel like it will start from me, because I had to educate her myself on the symptoms of menopause. These things come with menopause. I feel like it starts from the individual, probably the children, because the adults at that point, they may not know. I mean, for our mothers, I don't mean us.
Okay.
No, someone like me, now, if I get to that stage, mentally, I will be prepared for menopause. But then for the older ones that already experienced this thing or almost experiencing these things, I feel like from their family members, if they could be knowledgeable enough, educate them on, okay, this is a normal thing that is happening to you. And then you don't have to feel so bad about it. And you should actually voice it out when you feel them. Because for the mood swings, voice it out. This is how I feel. It will help people to understand that, okay, this is not normal. And then, this is not normal before now. So because you're experiencing menopause, it's actually normal for you. And then it will clear. It will get better. Because it is from the perimenopausal and then the menopausal stage that it gets worse. from the post-menopausal stage. It gets better. They're used to it, and then the fluctuations in their hormones levels actually drop to an extent, and then their body adjusts to it automatically. And over time, they're okay.
All right. Yeah, because that's the truth, that there's not much awareness. People don't know about it. For someone who also has a mom who is perimenopausal, getting to the menopause stage, you see that the knowledge is not there.
It's not.
Right.
Really.
Because I remember, I think I was still in nursing school then, the first time she ever mentioned something like that. She's like, I'm feeling hot and all those stuff. I'm like, Mark, are you sure this is not menopause? Like, menopause, Nigerian mothers, the way they talk. But it's important that this knowledge gets out there, because I think it's even affecting them socioculturally. When these women get to this point, they don't have the right guidance. They don't know what to do. Some of them don't even understand what is happening to them. Yeah, so they go from pillar to post, running around. And I saw on social media, someone was saying that it's why when a woman gets to around like early 40s and the rest, her relationship, in this context, marriage, gets a little bit dicey. Because you as the husband, which will still get to them, but all of a sudden you realize that your wife is not like she used to be, because she's going through a couple of changes that actually everybody should know. Mm-hmm. Just like young girls go through a couple of changes during menstruation and puberty, which parents should know. So, in as much as we know that menopause is not a disease, but it brings out some effects that may not be too pleasurable or desirable. So, what are the options we have that we can help tame this effect and make this transition period to be something that they can go through in a good way?
Okay. First off, this period for them, like I already talked about, can be very challenging, and they don't know. So first of all, the knowledge. I feel like everybody should read on these things more. They should be more aware, from the women to their partners, their children, their immediate family members. They should be aware that, okay, these things are normal. The same way they see puberty as being normal, they should be aware that, okay, menopause is normal. And then for people that have partners, people that are still married, I think at that point, and it's actually at that point that for some persons for women that had children earlier on, at that stage, their children are all grown out and then they've left. So the whole business of taking care of children, betting them,
distracting you.
So you're now so quiet and you're now reflecting on your life. At that point, you have less things to do on your hands. So I actually encourage from you yourself. I think there's this actress I like, Educator. Okay, she does exercises. She's very, very agile. I think she's around 40 something or
50.
50. Yeah. I said she turned 50. Do you get? And she looks so good, and she lifts good weight. I feel like if women could actually embrace exercises more towards that age, it will help. There is proven record that exercise helps your mind, calms your mind, and then it also improves your cardiovascular function. So for women that are having this, because one of the symptoms of menopause can actually affect your cardiovascular system in general. Okay. So for women that, if they can embrace this healthy lifestyle, exercise, very important. If you can, you don't have to lift. I'm not saying you should lift weights like potential. You can actually do regular home exercises, like you could walk long distances.
Yeah, aerobics and jogging, light jogging.
You don't have to go lift weights at that age, especially people that have other medical conditions that may not allow them to do that. And also their partners too. At this point, you also help them to be like, you should understand with them that, okay, people that are married or people that have their partners, this is normal for them. So you should be there for them emotionally to also cope the symptoms of the emotional symptoms that comes with menopause, like the depression and anxiety I talked about. I think that reassurance from their partner and their children or their loved ones that, okay, we are still here for you, whatever you need from us, can actually go a long way into helping their moods most of the time. So, like I said, exercises and then reassurances from their loved ones, their partners will help them go a long way. And also, there are some vitamins that you can take. Like for people that are prone to osteoporosis, you could take vitamin D supplements. This will help your bone health or other and then you eat switch too. Nigeria will not allow you eat switch in this economy. But you can try with vegetables. You don't have to eat, if you cannot eat so rich, at least we have the common veggies around us. Exactly. You eat more of those things. They give you the vitamins that you don't know, but they're giving it to you. And these things affect your mood, affect your general well-being. You understand?
All right. So it's nice that you've come from a point of a healthy lifestyle, because unlike what we see around, most people always go from a point of drugs, but it's important to know that something can be done about this from the aspect of lifestyle and from the things you eat and, from changing the way you live your life. Like I said before, the decline in this hormone may not allow you to do the things or perform like you used to before. I think because that's always the problem people have. I used to do this. I used to be able to do that. I could walk from here to here. You need to listen to Nigerian mothers when they're giving gist.
Yeah, it's true. Yeah. I could weed two plots of land
on myself. But you're no more that person. If you've been to weed half plot, what's even half plot? A quarter plot, your waist, will tell on you. So it's important that way. But for people who have like very extreme symptoms, they may need to get into the hospital, get assessed, and get some hormone replacement therapy done so as to see how they can curtail the effect. And thank you for looking into the community, because the community and the society is something else entirely, right? Pushing blame and the rest when these women cannot perform like they used to perform. And like you said, the men, which was still going to come to them, because the men, in the context of our environment, most times being the partners, do not think to understand with these women that these women are going through something. And that's why I keep saying, and I say it again and again, knowledge and information is the highest when it comes to any form of disease. Because if people understand this, you have empathy towards someone who is actually experiencing that. Yes, because most of these men don't. This woman used to cook like 3 pots of soup a day. She was okay when she could do it, but now she's not being able to do it. You say it must be 3. If it's not even 2.5, you will not call it. But it's not supposed to be so. There is lots of physical strength. Fatigue comes with this diminishing in these hormones. And that brings me to the men. Because most times, I want to ask a question, but I want to bring it this way, because by the context of how people marry, just like women experience menopause, men experience andropause, right? Where they also have this signs and symptoms, although a bit different. For men, it's just the reduction in the testosterone level. They can't function as they do, because testosterone runs a man. His sexual function, his physical function. Now, for men that are like this, and they also experience these signs and symptoms, do you think, wouldn't it, just flashing my mind, wouldn't it be okay? Do you think they would be more empathetic if me and my missus, we are going through this same thing at the same time? So let's say I'm experiencing andropause and my missus is experiencing.
I think so.
Do you think that will make them a little bit more empathetic of each other? I
would say so, because you could be able to relate to these things other than just hearing this person tell you how they feel. If you could relate to maybe half of this, I feel like that's why I feel like men should actually be passing through menstruation, so they can relate to the pain that comes from menstruation. You get? So if
the studio manager wants to.
So if actually men should experience the symptoms of menopause. Number 1, during sex, the woman's vagina. I didn't even talk about the vagina.
Yeah, no, we'll get there. We'll get there. Yeah.
Okay, before we get, so if they could experience these symptoms, at least a part of it, they'll be able to have more empathy towards these women. That, okay, this thing is normal. So as my wife, I should understand with you.
Okay, man, I'm coming. Let me also defend you people. Do you think that if women could experience andropause, the fact that our sexual function, our sexual strength goes down, that they'll pity us? They'll not want us to be going 5 rounds every night. Because most women don't know that. It's not every time that we feel in the mood, but that's the truth. This affects sexual function, and that brings us to sex and menopause. Now, how does sex affect a woman? How does menopause affect a woman when it comes to sex?
Okay, I think there was a study that was done a few years ago I had to read through. You notice a lot of women complain of vaginal dryness. You get, it is from ovulation and the hormones in the body that helps with secreting the vaginal fluids, that helps lubricate the vagina naturally. During sex and every other day, your vagina is not supposed to be dry. So for women that have this decline in these hormone levels, your vagina gets dry, which is natural.
But it's not natural for men. No? Men would not accept that natural.
They have to accept it. That's why I am here. So at that level, you should understand that this person's body is not how it was when you guys got married together. Yes. And then for some women, they can have low interest in decreased libido.
Yeah.
It's normal. So they may not really be up for sex every now and then, like the way back then. So they just want to be on their own, pass enjoy their life issues at that point in time. You get? So for you as the man, there are other non-sexual things you could do to bond
Build
and build
intimacy.
intimacy with this person. Like hugs from the back, cuddles, warm baths, and all those things can help to. Both of you will feel good without engaging in sex.
In intercourse.
Intercourse itself, you get. And then for people that really have to engage in intercourse, I'm not saying you should stop intercourse, totally. I'm saying you should give her time to also want to do this thing. Not because as a man, I want to have sex, so I must have sex. Because the one says, okay, I don't want to have sex because I don't feel like, you should understand with her. But if you guys, both of you agree that, okay, you want to have sex, there are other things you could use like lubricants. That's why you have the lubricants in the drugstore, the pharmacy drugstores you could get. And that will also help to enhance your intercourse.
Okay, so
lubrication.
Yeah, I'm not giving you advice, but I'm just saying it's important that when you're building whatever you're building in the context of a relationship, that you try to find a way to build intimacy away from sex, right? Because it's going to, even if it doesn't help now you can have it in the morning, have it in the evening, have it in the night, but the time will come when you may not be able to, and you may need to seek for other forms of There's some people that they cannot do anything if it doesn't end in tata, as far as they're in a relationship.
Actually.
And in fact, let me not make this look like even some women, I've met women who say that, no, you cannot say that you are my person and there's no sex. There are women that say they have, because when you speak to people, they talk about high sex drive, high libido, and people talk about sexual compatibility. Sometimes they'll be like, I'm high libido, I need somebody with high libido. And you tend to forget that sometimes this libido will dwindle down. Now, for the fact of individual differences, if the both of us are partners, yours may dwindle, mine may not. Mine may dwindle, yours may not. And that will also become a problem. And for the fact that the vaginal wall thins out due to a less supply of estrogen, women who are undergoing menopause are more prone to having vaginal tears, thereby exposing them more to, they have a higher risk of having sexually transmitted infection because of those tears. So please help your women. Their pelvic muscle, like she mentioned, osteoporosis, where the bones become more fragile. It affects the pelvis. She cannot do all those styles. Hang your leg on the fan, turn like a toad, and all those styles. It's important that you have this knowledge. It's also essential that she is more prone to experiencing prolapse.
Yeah,
because the pelvis cannot hold it again. So most of this. So women, it's essential that the kind of life you live before your menopause can also affect you as it pertains to menopause.
Okay.
Now, this is really for women who are having multiple children. I'm talking about children like from 5 up. They've already placed strain on the muscles of the pelvis, and it makes them to become a little bit more prone to prolapse of the organs that are in the pelvis. And this also is to men. Andropause comes to men. You will not have your sexual function as much as you could. Now, most times when this andropause comes and your sexual function depletes, they turn to sex enhancers. Now, they take so many things, herbal, the traditional medicine, whatever they see, just to last, not knowing that it's a natural decline in their sexual function. So just before we go, how does menopause affect the family dynamics? Because most of these women are in the family, children, husband, relative, mother-in-law sometimes. So how does this affect their dynamics? And I think you've already mentioned it, but you may throw more light on it. And based on this affectation, how can the family help her to go through this stage? Okay.
So I would say I've already talked about how it affects the man directly, probably the partner also. So for the general family, I think it would be the mood disorders that would be the major factor, because when these things set in, like the depression I talked about, they're not in the mood. They don't want to talk to people. They just want to be left alone. I think you should be able to understand with this person the immediate family members. You should understand with this person that, okay, this person did not used to experience this before now. And then talk to the person, get to find out, okay, when did this start? Make inquiries. Take them to the hospital. In severe cases, please take them to the hospitals. They are clinically diagnosed. They will give you medications, which will help them get better. And then for you, as the family member, you can help to show them love. We say, show me love. Show them love by being there for them, understanding that, okay, this is a normal thing happening to this person. just be there for them. I think for some person, they don't even need you to do much. Just be there that, okay, I am here. Whenever you need me, whatever you need from me, I am here from you. From the children to the husband to the extended family members, understand that, okay, this is a normal process for this woman and it will get better. And if they need medical attention, please take them to the hospitals. Just be there for them.
Yeah. So just be there for them. I remember when I had to, talk to a lady, a very prestigious lady who was wondering what was happening with her. There's a lady that is a manager in a multinational oil company, but she's like that. She's been having so much complaint from the husbands and the children, that she's quite temperamental. That was the word they use on her, that she explodes with every little thing now. So she started asking, I think she started looking around what's happening with her. She realized it was menopause. So she decided, to get like a professional info on what is actually happening to her. So these are some of the things that you may expect from the ladies in your life who are going through this process, right? The mood swing may make them a bit temperamental. They may react like they don't usually do
before now.
So it's important for you to know that this is happening. And I think I want to push this also to people out there in all organizations. I'm talking about religious organizations, corporations, your women functioning in whatever role it may be. When they get to this point, this may even affect them at work.
Their performances.
Their performances. So it's important that organizations out there, they make modalities, right? So you give maternity leave.
Actually.
Yeah, they do. Now, you give, sometimes if a woman comes in for people that have very painful menstruation, they may give them excuses.
To go back home.
Yeah, to go back home and the rest. You should also look at women who are going through the process of menopause, whether they're in perimenopausal stage or the actual menopause, so they can see how they can cope. It's also important that organizations like this bring out awareness campaigns. You see, when menstrual hygiene campaigns are being done, organizations key into it, buy period supplies for their staffs, call people in to come talk to their staff. You can also do this for people who are going through this process of menopause. And if you do this, you help them. And when you help them being the women being the custodian of the nation, God bless each and every one of them, you help them to be better people and for them to function better. So that is what we came to tell you, that you should actually give as much support as you can, either as a person, either as a family member, even as a health professional out there. You see women who maybe in one way or the other, they may come to seek another service, but you know that they're actually approaching this. You could give them this information for them to be able to make informed choices. So, Famti, do you have any last words for us?
Okay. I think you said almost everything and I would like to say. But then I'll also say from the churches, when you're preaching, at that moment, at that point, probably from partners, people have been married for a long period of time. From the pastors when they are preaching, telling people that, okay, as your wife is at this stage. I feel like for churches, from the church, people should start preaching about these things and start shying away from sexual matters when it comes to church. They preach about holiness and faithfulness and all of that. And they shy away from sexual matters, bothering human beings. And this is like one of the most important parts of our lives. So I feel like from churches, people should actually start talking about these things more. Hold like seminars for women. I see people hold medical outreaches that has to do with diseases like hypertension, diabetes. You could hold seminars on these things. You get, and just talk about, educate women, even the men, just educate the elderly ones on these things, on these conditions. I think from there, from churches, from your employers to understand that, okay, this is normal for this person. And then you could give that person grace and time to come out of that stage.
All right. So it's essential that awareness and knowledge is being given to everyone across the board, especially the people who are going through this process. And we believe that if they have this knowledge, people will make better choices. And when they make better choices, we have better outcomes. And even for people who may say that, I'm talking to the men here, who may say that I do not experience this. But if you have this knowledge, you better understand your partner, you better understand the women in your life. And you'll also be, able to help them and to support them as they go through this process. So that is what we have for you from this episode of the Intimate Matters podcast. And we're glad that you're sticking with us to the end. Do well to engage with us on all our social media platforms. You can join our official WhatsApp group, and there you can interact with us and you could ask questions. Do not fail to make suggestions. If there are any topics that you would want us to discuss, we will be glad to discuss it. And We're grateful to have you, and this is the Intimate Matters podcast. And on this podcast, we believe that your intimacy matters. I am Nurse Akwaowo Akpan, and this is bye for now.